Welcome to John Luke's educational video about injury awareness and preventative measures. There are many injuries that occur in sport, but there are ways to stop them from happening, which we'll cover in this video. The benefits of sports massage will also be covered in this video. Sports massage is used to help and prevent injuries.
The two types of injuries are intrinsic and extrinsic. Extrinsic is an injury that happens outside of your body that you have no choice in. For example, a two-footed challenge from someone in the opposing team. An intrinsic injury is an injury that takes part inside of your body. For example, pushing yourself too far in training and pulling a muscle such as your hamstring. Extrinsic things that affect injury are things like equipment, environment and training errors.
Intrinsic is an injury that happens inside the body. An example of this is someone pulling their muscle. Intrinsic factors that affect injury are things like your age, gender, anatomy and biomechanics. These are factors that you are unable to change.
A coach plays a very important role in injury prevention. If they do this well, then many injuries will be avoided. One of the roles coaches play is making sure the playing surface is safe to play on. This means making sure there are no sharp objects on the pitch, which will then avoid any unnecessary injuries.
Another role is checking that everyone has the correct equipment, like shin pads and the correct studs on, to avoid people from getting serious injuries. They also have to carry out risk assessments for every session. This shows that they have identified all the possible risks that can happen in a session and shows they know how to prevent them.
Coaches have to have an update and relevant knowledge and qualifications for their relevant sport. They also need to have good knowledge of their players' abilities. This means they have to know everyone's strengths and weaknesses, meaning they need to treat everyone equally and don't single out any certain people because they have different abilities. The coaches must assure that the players stick to the rules and regulations to avoid any unnecessary injuries that might occur from not following the rules of the game. It is also very important that a trained first aider is present. This is so that if a player does get an injury, the first aider can attend to them as quickly as possible. The equipment must be the correct size. For example, children aged 10 shouldn't be using size 5 footballs because they are for adults. A child that age should be using size 4 or size 3 footballs. We are now going to demonstrate how to prevent an injury in football. This is common in football because there's a lot of kicking, and I'm now going to kick him in the shin. He isn't wearing any shin pads for this one. There's a possibility that he might have just fractured his shin or maybe done other damage to his shin. Now he's put shin pads on and I kick his shin. He's fine. The pain has been taken up by the shin pad and there is no risk of injury.
I'm now going to talk about the effects and benefits of sports massage. The effects on the skeletal system are massage can help increase joint mobility by reducing any thickening of connective tissues and helping to release restrictions in the fascia. It helps to free adhesions, break down scar tissue and decrease inflammation. As a result, it can help to restore range of movement to stiff joints. Massage improves muscle tone and balance, reducing the physical stress placed on bones and joints. An example of when this would come into action is when a footballer has an injury that has caused a build-up of scar tissue, such as a pulled hamstring. Then the massaging would focus on breaking down the scar tissue to help recovery and make sure it doesn't happen to them straight after they recover.
The effects on the muscular system are: massage relieves muscular tightness, stiffness, spasms and restrictions in the muscle tissue. It increases flexibility in the muscle tissue due to muscular relaxation. It increases blood circulation, bringing more oxygen and nutrients into the muscle. This reduces muscle fatigue and soreness. It promotes rapid removal of toxins and waste products from the muscle. An example of when this would come into action is when a footballer gets a massage after training or before a game to reduce fatigue so he can play his best.
The effects on the cardiovascular system are improved circulation by mechanically assisting the venous flow of blood back to the heart, dilate blood vessels, helping them to work more efficiently, produce enhanced blood flow, delivery of fresh oxygen and nutrients to the tissues is improved, and the removal of waste products, toxins and carbon dioxide is hasted via the venous system. Help temporarily to decrease blood pressure due to dilation of capillaries, decrease the heart rate due to relaxation,
The effects on the lymphatic system are: reduces edema, which is excess fluid in the tissue, by increasing lymphatic drainage and the removal of waste from the system. Regular massage may help to strengthen the immune system due to increase in the white blood cells. The effects on the nervous system are: massage stimulates sensory receptors. They can either stimulate or soothe nerves depending on the techniques used. It also stimulates the parasympathetic nervous system, helping to promote relaxation and reduce stress. Massage helps to reduce pain by the release of endorphins. Endorphins are also known to elevate the mood.
Now I'm going to talk about how specific mechanics of sports massage benefit the individual and can be used to treat and prevent injuries. The stroking movements in massage suck fluid through blood vessels and lymph vessels. By increasing the pressure in the front stroke, a vacuum is created behind. This is especially important in tight or damaged muscle tissue, as a tight muscle will squeeze the blood out of it like a sponge, depriving the tissues of vital nutrients and energy to repair.
Increased tissue permeability. Deep massage causes the pores in the tissue membranes to open, enabling fluids and nutrients to pass through. This helps remove waste products such as lactic acid and encourage the muscles to take up oxygen and nutrients, which will help them recover quicker.
Stretching. Massage can stretch tissues that cannot be stretched in the usual methods. Bundles of muscle fibers are stretched lengthwise as well as sideways. Massage can also stretch the sheath or fascia that surrounds the muscle, so releasing any tension or pressure build up. This can be used before training in football to relax muscles and get rid of any fatigue tension in the muscles that might cause the muscles to become strained.
Break down the scar tissue. Scar tissue is the result of previous injuries or trauma and can affect muscle, tendons and ligaments. This can lead to inflexible tissues that are prone to injury and pain.
Improve tissue elasticity. Hard training can make tissues hard and inelastic. This is one reason why hard training may not result in improvements. Massage helps reverse this by stretching the tissues.
Opens microcirculation. Massage does increase blood flow to tissues, but so does exercise. What massage also does is open or dilate the blood vessels, and by stretching them, this enables nutrients to pass through more easily.
Pain reduction. Tension and waste products in muscles can often cause pain. Massage helps reduce this in many ways, including releasing the body's endorphins. Relaxation. Muscles can relax through heat generated circulation and stretching. Mechanoreceptors, which sense touch, pressure, tissue length and warmth, are stimulated, causing a reflex relaxation. I am now going to describe the roles of sports massage therapists in treating and preventing injuries. Sports therapists give advice to sport and exercise participants on how to train and compete safely, as well as treat injuries and assist with rehabilitation. Their aim is to prevent injuries and to help those who are injured to return to full fitness. Sports therapy and rehabilitation is concerned with musculoskeletal conditions arising from sport and activity, not with general healthcare. It focuses on understanding and preventing sport injuries and dealing with the effects of physical and emotional trauma due to sport and exercise related injuries. Sports therapists may work in sports injury clinics or may work directly with a sports club or sports person, either professional or amateur. Many therapists combine working in this discipline with other sports-related roles. They may have a range of clients and workplaces rather than being employed by one organisation. Typical work activities for a sports therapist include things like conducting an assessment of players, athletes or participants, readiness and advising on exercises prior to an event, testing joints for ease of range of movement, strapping, taping, offering massage and preparing players or athletes, both physically and mentally, providing emergency aid in sports and exercise environment, examining and assessing injuries and determining whether the athlete or participant can
Exam-
continue playing or taking part.
Examining and assessing injuries and dealing with traumas, for example cuts, bruises and blisters. Treating injuries, alleviating pain, mobilising injuries and giving various types of massage. Rehabilitating injuries by using manual therapy techniques, apparatus and electrotherapy. Designing and monitoring rehabilitation programs appropriate to the injury or sport and level. Deciding whether athletes, players or participants need extra treatment and coordinating referrals to the other practitioners. Advising players or athletes on diet and nutrition when therapists are appropriately trained. Working alone with coaches, trainers or fitness advisors to implement exercise conditioning, core stability and injury prevention programs so that athletes, players or participants reach and maintain peak performance. Liaising with other health professionals in the sports sector and in mainstream medicine. Thank you for listening.